Hi, good afternoon. I'm Camellia, an APRN, a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And as I promised, I am back on here today to talk about nurse things. But one of the things that has come up just around me quite often that I wanted to talk about has to do with distance education programs when you are pursuing an advanced degree in nursing. Um, I actually, most of you saw that I did a blog and wrote a blog, posted that this week. So I really wanted to get on here to expound a little bit upon some of my points there. So today I'm going to be talking about 4 questions that you should ask yourself before your distance education pursuit. And this is the nurse edition. And of course, again, I only speak from experience. So you guys know that my journey has been nursing for since about 14 years ago. And I have pursued the advanced degree route with a distance education program. So I am actually speaking from experience here. Some of these points could likely be used for anyone who's considering advancing their degree in any career. So many of you may be at a crossroads like I was a few years ago, where I was first kind of figuring out what I wanted to do. I knew I wanted to advance my education. I was led to the nurse practitioner route because I wholeheartedly wanted to continue working with patients. I also knew that I could also do some education within that role. So I did move forward with the nurse practitioner route. But after making that decision, I then began to seek out programs. And basically, where my life was personally and professionally at that time, a primarily distance based education program was most suitable. But I wanted to actually move forward with a program that I was comfortable with that would prepare me to be able to sit for my boards and really have the full knowledge base that I needed to actually practice. And so, of course, information overload usually happens when you're looking at that. If you're a nurse, if you're maybe looking at that now, you know that there are lots and lots of programs. And also, just from a few years ago, those programs have really kind of exploded in terms of the number of programs out there. So, because of that information overload and because of the things that we have to really consider when it comes to our degrees and kind of what we're going to do with those degrees, the roles that we're going to have to take on. There are a few things that we have to kind of keep in mind before we kind of make a decision around these things. And the questions that I'm going to talk about are really questions. I mean, I didn't really have anyone to bounce off of when I was kind of in this period of my life and career. But just kind of in hindsight, I've thought through some very specific questions and ones that probably are more relevant now for those who are considering pursuing an advanced practice nursing degree, whether that looks like nurse practitioner, nurse educator, a CNS nurse, certified nurse specialist, and or a CRNA. And of course, most of those programs are not online. So I just wanted to just kind of get on here to talk a little bit about the 4 questions that I wish someone had kind of posed to me prior to me moving forward. I am happy with the decision that I made. Of course, I did go on, I passed my boards, and I have been able to practice for the last few years. And I overall have done fine with that. But just after some careful thought, there are a few questions that I think that would maybe help someone who's kind of in this decision-making process and not really sure which way to go. So number 1 is when you are looking to pursue an advanced practice nursing degree that is primarily based on from a distance education program, question number 1 is, what value does the program showcase? Okay, so assessment of a distance education's program, their value is essential. And there are a few different components that you can look at to determine value. First is there's acceptance criteria. This usually speaks to the program's rigor, their academic standards, things like GPA, prerequisites, GRE requirements, what's the applicant to acceptance ratio. All of those things matter. And just a little bit about applicant to acceptance ratio. You don't really want a program that is accepting any and every one, that doesn't really have true standards around who's accepted. A fairly competitive program usually means the program has pretty good value. Also, you'll run into, other things down the road, with having a program that just, accepts anyone. So you really want to be able to sift through the programs that don't really have kind of the standard academic, criteria to meet to be accepted. It's also never too much. I still say this even as an APRN, that it's never too much to ask for the pass rates for board examinations for prior student cohorts. That really will speak to the program standards, whether students were able to kind of grasp the information in the format that it was presented, to be able to go on and pass their boards. So it's still a relevant question, even with an APRN degree. This also matters, guys, because you don't want to really be attending a program, at least, speaking for myself here maybe, but you don't want to be attending a program that doesn't have scholarly standards. We all know that we've worked really hard in nursing to get where we are. And so in a sense, we don't really want that to be minimized at this point. This isn't a point to kind of have a break. And keep in mind that the reason value is so important is because it lines up usually with credibility of the program. And so the last thing that we want is for a program to be turning over degrees, not really have, set scholarly standards, and to basically be diminishing or lessening the value of the nursing profession and the credibility of the nursing profession as a whole. So my takeaway here with this point about value is to, if possible, consult with a few nurses who maybe have gone through this process at that specific program that you're considering. One easy way to do this is to join social media groups. I'm actually a part of a Facebook group for PMHNPs, or psychiatric mental health nurse practitioners, and a lot of the people there are pursuing the degree, and they're actually maybe even students, and they usually always bounce out questions about specific programs, and so that can be helpful. Just kind of bouncing around your questions to people that have already kind of gone through the process. Question number 2 is, am I prepared? This is not specific to distance education. It really is just specific to advancing your degree. But consider whether you are prepared for applying to the program. Okay, so that means do your research about what's required. Again, if not much is required, then that may be a red flag for you to think about value and credibility of the program. Take the GRE if needed. There are some programs that don't require the GRE. I actually went through a program that did require me to take the GRE, and prepare yourself to retake it if needed. Okay, so with that, give yourself time. Also, just prepare for notifying your references to allow ample time for you to send in your application. Okay, and this is for the person who maybe hasn't gone through this process before. Also consider whether you have the work experience. Really look at the fine line, with a lot of these programs in terms of criteria, what will make you more competitive. And so this may mean well ahead of time, you are looking forward to, maybe moving jobs to get that type of experience that you kind of want to move toward, or may be required before you apply to a specific program. There are programs out there that still require this. I actually did move and change my job to an acute care behavioral health facility prior to applying to gain some of the experience. And of course, that also helped me, with what I'm doing now and kind of working in behavioral health. So really just kind of keep that in mind. Look ahead if what you need is to kind of move to a different patient population. And usually those requirements are relevant to the program. And so again, that does still exist. It doesn't always mean years of nursing experience. Sometimes it's just experience with a particular type of patient population. Okay. Number 3, this is also another personal consideration. Is it the right time? I did another blog related to advanced nursing education, and I touched on this a little bit, but consider if it's the right time for you. Only you can determine that. So I can't tell anyone, if it's the right time for you. Some people live by the fact that there is never a good time, but only you can determine that. And so the reality is that distance education is different. Some of us may be figuring that out now because we may have been forced to kind of go forward with online education or distance education, distance learning, but it is different. And everyone kind of gains and kind of has a different perspective about this, but it does require, and from my experience, it required much more time and much more kind of an independent paced, really just to grasp, just pacing myself, more so kind of learning, helping myself to learn to be able to grasp the information. Okay. So ask yourself if it's the right time for you to fully commit to the learning process. And keep in mind, guys, that it's great to have the degree. It's great to have the alphabet behind your name. But keep in mind that you will have to pass the certification exam. That exists for most of the advanced practice nursing degrees. And you will be expected to practice with this knowledge. And so it's that important. So make sure that you have the time that you can fully commit to, really learning and grasping the information to carry you forward. Okay. Question number 4, this is the last question. And this is specific to a question for the program. Are practicum sites prearranged? Okay. This also, of course, ties into preparation and value. But based on my experience, clinical placement, really, it deserves its own discussion, probably a separate blog and a separate video just about clinical placement. But when you are looking into programs, find out whether clinical or practicum placement is sought out for you. Okay. There are some programs, and again, this ties into value and credibility, that don't have prearranged organizations that they've worked with or have their students to work with, for their practicums. So there are most of the programs actually do, believe it or not, have this etched out. But there are many reasons that this doesn't kind of work out perfectly. And one of the things that I've actually seen more recently, and this kind of ties into all of these programs kind of, accepting everyone, is that we have so many students kind of going into these programs that we forget that we're leading to, having a saturation of students in a specific area that actually are going to need clinical placement. And so, of course, we can't have, as a preceptor, you can't have more than a certain amount of students. Some don't have time to have, multiple students. So those are just some of the reasons that it doesn't work out. I will tell you, this is a global concern. But, sometimes, it has to do with just the saturation of students in a particular area. So my action step from this is also to seek your own, and using this as an alternate kind of, placement. If needed, seek your own in your areas. Well before you apply, I would recommend doing that. This can really be a tedious process, guys. And if you don't prepare, I have run into students kind of being delayed from graduation because they weren't fully prepared in terms of getting their clinical sites established. or having to travel long distances to still fulfill your requirements. Okay. So just kind of do your own work there, just in case it's needed. Hopefully the programs are all getting on board just in terms of credibility and value, where we are able to kind of have those pre-existing sites already in place. Okay. Another thing to think about when you are looking at your own sites, there's also, of course, there are benefits to that. It can actually, be a good thing for you in terms of networking. A lot of times students that have been, at a particular site actually end up getting offered jobs as well. So that's one of the benefits of you kind of, handpicking your own practicum site, so that you kind of know the value, but you also kind of know, down the road if that's possibly a place that you want to work. In addition to facility placement, this is also under kind of the questions about practicums. Be prepared for a substantial amount of time to get those hours. Okay. My program actually had more hours than most programs. We had over 700 hours that had to be acquired prior to graduation. And that's a lot. So most programs require, you to have at least a certain amount of hours per week. So it's almost similar to a part-time, a little bit more than part-time job. So if you are a person, and I was this person, if you're a person who is a working professional in addition to going to school, then consider that you're going to maybe have to sacrifice or maybe make some changes to your schedule to be able to fulfill these hours. I actually, at the latter part of my program, actually had to move to become a weekender, just as an example, because my Monday through Friday time was actually spent just for clinicals and practicum, hours and getting that done. So, and again, my program required at least 100 or so more hours than most programs. So keep that in mind. Maybe you're going to have to make a sacrifice down the road, but be kind of prepared for that. And also understand that that's temporary. Okay. If you're planning to also work while you're completing a program, just as kind of an aside here, be transparent with your employer. A lot of times if you let them know ahead of time, they're willing to work with you. Of course, that depends on where you work. But it may be required to save you some stress down the road, just to be able to coordinate your schedule with your practicum hours, and also just to have a little bit more flexibility. Okay. Now I hope you guys, I hope that this has been helpful for you guys. These are just 4 questions again that I wish someone had kind of, probed me about with the program. But again, I'm fully happy with the program that I did pursue. But it would have probably saved me some stress and kind of, down the road in terms of, thinking through exactly what to do. So, keep in mind that all of these programs are not apples to apples, so we can't compare them all, but there are, again, a lot of them, so just kind of keep sifting through based on these questions. Some of these things are, of course, things to ask yourself, but also things to ask the program, okay? Take time, do your research well before you apply, and just consider, the benefit of that is saving you time down the road, but it can also, of course, save you possibly dollars and money down the road. So it could be highly worth it. I am hopeful that this video, although very long, was helpful in some way to someone. And some of you out there who are at this point of your career, you're considering a degree, an advanced practice degree, maybe distance education, maybe a hybrid program, but a lot of these things still apply. And so hopefully this was helpful to someone. I would love to hear from you guys. Please leave comments. Maybe your experience has been a little different, or if you feel like there's something else that maybe would be a good question for other people, other applicants or students that are people that are going to be students and applicants, just please comment below. I'd love to hear from you guys. I'm all about having this dialogue to help each other.